HIV is the human immunodeficiency virus. If you have HIV, you have an infection that damages your immune system over time and causes AIDS. AIDS stands for Acquired Immunodeficiency Syndrome. It is the final stage of an HIV infection when your immune system is damaged and too weak to fight off ordinary infections. When foreign invaders, such as bacteria and viruses, get into your body, they can cause infections. These events activate your body's defenses. The white blood cells of your immune system are part of your body's defenses. One type of white blood cell, called helper T lymphocytes, or helper T cells, strengthen your immune system's response to infection in two ways. First, helper T cells release chemicals that attract other white blood cells to the site of the infection. These additional white blood cells attack the invading bacteria or virus, as well as other infected cells. Second, helper T cells release chemicals that cause other white blood cells to multiply. These new white blood cells create markers, called antibodies, which can identify the same foreign invader throughout your body. Antibodies attach to the bacteria or virus, marking them as targets for your immune system to destroy them. HIV can enter your body during unprotected sex, while sharing drug injection needles, during your own childbirth, while breastfeeding from your mother, or from contaminated blood or blood products.
When HIV enters the body, it establishes itself in the lymphoid tissue.
The virus enters helper T cells, which are the primary target.
Entry of HIV into the cell requires the presence of certain receptors on the cell surface. CD4 receptors and co-receptors such as CCR5 or CXCR4. These receptors interact with protein complexes, which are embedded in the viral envelope. These complexes are composed of two glycoproteins, an extracellular GP120 and a transmembrane GP41. When HIV approaches a target cell, GP120 binds to the CD4 receptors. This process is termed attachment. It promotes further binding to a co-receptor. Co-receptor binding results in a conformational change in GP120. This allows GP41 to unfold and insert its hydrophobic terminus into the cell membrane. GP41 then folds back on itself. This draws the virus towards the cell and facilitates the fusion of their membranes. The viral nucleocapsid enters the host cell and breaks open, releasing two viral RNA strands and three essential replication enzymes: integrase, protease, and reverse transcriptase. Reverse transcriptase begins the reverse transcription of viral RNA. It has two catalytic domains: the ribonuclease H active site and the polymerase active site. Here, single-stranded viral RNA is transcribed into an RNA-DNA double helix. Ribonuclease H breaks down the RNA. The polymerase then completes the remaining DNA strand to form a DNA double helix. Now, integrase goes into action. It cleaves a dinucleotide from each 3' end of the DNA, creating two sticky ends. Integrase then transfers the DNA into the cell nucleus and facilitates its integration into the host cell genome. The host cell genome now contains the genetic information of HIV. Activation of the cell induces transcription of proviral DNA into messenger RNA. The viral messenger RNA migrates into the cytoplasm, where building blocks for a new virus are synthesized. Some of them have to be processed by the viral protease. Protease cleaves longer proteins into smaller core proteins. This step is crucial to create an infectious virus. Two viral RNA strands and the replication enzymes then come together and core proteins assemble around them, forming the capsid. This immature viral particle leaves the cell, acquiring a new envelope of host and viral proteins. The virus matures and becomes ready to infect other cells. HIV replicates billions of times per day, destroying the host's immune cells.
The result is that the CD4 cell count in the body decreases as infected cells are destroyed by the HIV virus. However, declines in CD4 cells in the bloodstream can take several years to reach very low numbers. Healthy people have between 600 and 1200 CD4 cells in a cubic millimeter of blood. When CD4 cells reach low or very low levels in the bloodstream, patients are at risk for getting serious infection called opportunistic infections because they take advantage of the body's weakened defenses.
Some of the common AIDS-related opportunistic infections are inflammation of the tissues covering your brain and spinal cord called meningitis, respiratory illnesses such as pneumonia and tuberculosis, intestinal illnesses such as chronic diarrhea caused by infectious parasites, and cancers such as Kaposi's sarcoma.
Once CD4 cells fall below a level of 200 cells per cubic millimeter in the bloodstream, or if a person has an opportunistic illness, this is considered an advanced stage of HIV infection, called acquired immune deficiency syndrome, or AIDS.
Although there is no cure for HIV, drugs called antiretroviral medications can reduce the amount of HIV in your body.
Entry into the host cell can be blocked by fusion inhibitors, for example. Inhibition of reverse transcriptase by nucleoside inhibitors or by non-nucleoside reverse transcriptase inhibitors is part of standard antiretroviral regimens. The action of integrase can be blocked. Protease inhibitors are also part of standard antiretroviral therapy.
These drugs prevent the creation, assembly, and spread of new viruses. Your doctor may prescribe a combination of these drug classes known as highly active antiretroviral therapy, or HAART. Antiretroviral medication doesn't completely remove HIV from your body, but slows it down enough to enable your immune system to fight infections. Treatments for the opportunistic infections of AIDS are medications specific for each type of infection. For example, your doctor may prescribe antibiotics if you have pneumonia or tuberculosis. To avoid getting or spreading an HIV infection, know your HIV status and your partner's status by getting tested regularly. The most effective way to prevent HIV infection is to avoid vaginal and anal sex. When engaging in sexual activity, you will be less likely to contract HIV if you only have sex with one uninfected partner or use latex condoms for protection. Avoid using injectable illegal drugs or sharing drug needles because the needles may have the virus on them. Avoid intoxication from drugs or alcohol because you will be more likely to engage in unsafe sexual behavior.